Welcome. Are you getting older? I'm getting older. Do you have aging parents? Feeling the effects of aging in any way, shape, or form in your life? The Oldish is definitely the place to be. This is where we talk about all kinds of issues related to aging. The good, the bad, the ugly, the uncomfortable. We talk about it all. Nothing is off limits. My name is Karen Brown. I'm the publisher and editor of The Oldish, and it's my pleasure to welcome you here again today. We do this every Wednesday at 12 noon. If you have not already followed us on Facebook, please do. Check that little like button, and every Wednesday at 12 noon we will be here. We're also on other kinds of social media. Instagram, Twitter, we're everywhere. We are at The Oldish on those platforms. So today, we're going to talk about mental health in older adults. The reason we're going to talk about it is because in Canada, it is Bell Let's Talk Day. Now, this is an annual day with a focus on mental health issues for all ages. Of course, we're going to talk about mental health issues with older adults specifically, but if you live in Canada, I would encourage you to use the hashtag Bell Let's Talk in your text messages and on all of your social posts. If you do that, Bell will donate 5 cents to mental health initiatives. Now, for iPhone users, turn off the iMessage. This only applies to texts. So send texts today, not iMessages, and you will get to contribute 5 cents through Bell Canada. All right, so the big picture is that mental health issues often go unnoticed in older adults. They're harder to spot, oftentimes because older adults are living on their own and their children, their adult children, may see them once a week, once a month. They may talk to them on the phone more often, but you can carry on a good conversation and fool anybody on the phone for a short period of time. The reality is that 15% of older adults who are community dwellers report significantly higher levels of depressive symptoms. That's really important because older adults recover from things like depression a lot more slowly than adults of a younger age. So the sooner these kinds of things can be caught and dealt with, the better off everybody will be. Higher rates of depression are reported by older adults living with chronic disease. That's not surprising at all. Those living in long-term and nursing home care report higher levels as well. We'll talk about those in a moment. This is important. Higher levels are reported by caregivers who are caring for a family member. If you're a caregiver, you need to learn to ask for help. We've done shows on that before. We've done lots of articles on that before. If you are a sibling or a family member of somebody who is a caregiver, please pay attention to the health of the caregiver as well as to the health of the person receiving care. It all matters. Depression is known to decrease functional abilities, interfere with whatever treatments are being pursued, and contribute to a decline in physical and cognitive function. It increases the risk of death in older adults by 2 to 3 times, so suicide in an older population is a real concern. It's very legitimate. Feeling sad or lonely is not a normal part of an ongoing process for adults, so be careful of that. Look for continued, unrelenting feelings of sadness or loneliness, having mood swings or low energy, not being able to focus on tasks. I'm going to just turn off these little things here. There we go. Not being able to focus on tasks or conversations can also be a sign of depression. Not just that somebody is having a bad day, a bad week, or reacting to a loss of some kind. If this goes on for a very long period of time, this could be a sign of depression, and you need to jump on that. Older adults often have too much time on their hands to do things like obsessing about the regrets in their life. If that becomes literally an obsession and that's the main focus of their waking hours, that's a problem. It's one thing to say, shoulda, woulda, coulda. Becoming obsessed, whole other ballgame. Somebody who doesn't feel pleasure in the things that used to make them happy. That's not normal either. Somebody with sleep issues. Now you have to ask the question, are you sleeping well? And you have to look, bags under their eyes? How many times did you get up last night? I mean, you can ask the questions to elicit a good feeling of whether or not they're having sleep issues. Big changes in how a person eats or in how much they weigh. These are also signs that something's going on. All right? Take a look at what they're eating. Open the refrigerator, open the cupboards. You can figure out how to do that. Bring them something and you've got to put it away, right? Anxiety is also a mental health issue, and it's something that does affect older adults. So when you see an adult worrying for a long period of time, you really do need to pay attention. What are you looking for? Phobias, PTSD, panic disorders, or obsessive compulsive behaviors. These are things to be concerned about. More things to be concerned about? Irrational fears. If you've explained things to them and quelled their fears, but they are still irrationally afraid of something, they may need to see a doctor. Checking and rechecking for safety. Now, this is an obsessive compulsive behavior, of course. Checking that the door is actually closed time after time after time. That the doors are locked when they go out time after time after time. Avoiding routines and social situations. If they report that their heart is racing or you see them stop and grab their chest, ask them if they have a racing heart. Is your heart thumping a lot? They might not respond to the word racing, but is your heart thumping? You having palpitations? I mean, really you want to try to use terms that are non-medical so that you don't freak them out, but you get the information. Shallow breathing, trembling, nausea, sweating, all of these things are signs of anxiety and need to be treated. So what do? Okay, sometimes in the early stages, small things can make a difference. So look around the community and see if there are activities that can engage their mind, give them another focal point. Because the more points of connection a person has with their community, the more engaged they are, the happier they will be. So do look around, look at the library, look at the community rec center, see if there's something going on that is appealing to them. You may have to take them to it a few times to see if they really do enjoy it and get them into that habit. Support groups are potentially important. There are often support groups that you can find through your hospital or through your doctor, also through churches and community centers. Counseling and therapy can work for many people. They can give training on how to counter undesirable feelings and thoughts. If it is ramped up somewhat, you may need to go the medication route. And of course, you need to see your doctor for that. Make sure you review all of the medications that this older adult is taking with the doctor. If you have a medication checklist, take that with you to the appointment. If you don't have one, there's one on theoldish.com. It's in the toolkit. It's free. You do have to have a subscription to the Oldish, which is also free. But what you write in that medication checklist is nobody's business, so it needs to be password protected. So do that. Don't discount medical cannabis as a treatment for depression and anxiety. There's a lot of really interesting work being done in that field, and there are medical doctors who are specializing in prescribing cannabis, and there are medical doctors who are very in favor of this. If you have a doctor who isn't a fan, you might like to look somewhere else if the other treatments are not working the way that you hope that they would be. There are also a lot of resources available through your local mental health association. You can probably search those online just as easily as anything else. So do take a look at those. Let's move on to long-term and nursing care, because this is a place where mental health issues are indeed dominant and prevalent, and they may look a little different. And we can risk brushing them off as, an adjustment. If your loved one has just moved in, we may see it as something that is just an adjustment. It may not be just an adjustment. I mean, Adjusting to a new environment is hard for anyone, but you want to get them engaged in activities that are going on in the facility as quickly as possible to overcome those adjustment nerves. The same treatments that we just talked about, all of the activities, the mental health association groups, support groups, and so on, they're all available. Family and friends need to make sure that they're visiting regularly, but the prevention piece with their is really crucial. Mom, dad, grandparent, whoever is living in long-term or nursing care, while you're there, be engaged with the facility. Get to know the staff. Help the staff come to know your parent or grandparent. Nobody knows them like you do. But let's face it, even if you visit once a day or once a week, nobody is with your loved one more than the staff that live there. And helping them to understand who your parent is will be very, very helpful in helping them know best how to support them. Make sure that the staff know about family events, because that will help them to support your loved one in times that may be regarded as crisis, times when they would perhaps normally have been more involved but aren't able to be anymore, and that might make them feel bad. So things like family weddings, divorces, most certainly deaths in the family. These are a few things that come to mind. So helping staff to know who your loved one really is and how they have responded in the past, what the family history is, will be a really helpful piece in making life a little bit easier and supporting your loved one through what could become a depressive period of time. Be aware that people who are challenged with dementia may have a sense in the earlier stages that things aren't right. It's a very unbalancing thing. And your reaction to that is going to matter as well. You know, if you're someone who's saying, Mom, I told you that. I told you that 10 times. Or why can't you remember? You may need to contact your local Alzheimer's Association for strategies to deal with people who have dementia. But focusing on the person who has dementia, if they are understanding that something's wrong with them, but they don't really know what it is, they can't put their finger on it, but it's getting worse and worse and worse, I'm sure you can understand how that could trigger depression or anxiety or other kinds of mental health issues. So you do really want to connect with a mental health professional and get some help with navigating the disease. It is really important to deal with mental health issues no matter the age of any individual. But it is, as I said earlier, very important to deal with mental health issues in older adults because they resolve so much more slowly. So the sooner you can catch them, the better. Patience is a virtue, and it will never be more needed than now if you are dealing with somebody who does have a mental health issue. Definitely don't ignore them. The sooner we talk out loud about this more freely, the sooner we destigmatize mental health issues in all populations, and that can only be a good thing. Join us next Wednesday at 12 noon when we'll have more issues for you related to aging. Until then, please do join us on Facebook, like us so that you see all of our posts. Every day, pretty much, we publish new articles on theoldish.com. Please do go and visit those. And also, mark on your calendar, next Wednesday, 12 noon. Be there or be square. Until then, please do remember that it takes a village to age a senior.